See if that works. Okay, can y'all see me now? Oh, yes. Okay. One of these days, we've been doing this for over a year now. One of these days, Vivian and I are going to have it down pat. I'm not sure when that's going to be, but we will. Okay, so if I am Ginger. I'm the registered dietitian here at the Bariatric Clinic. I'm just talking to y'all tonight about really general nutrition advice for after bariatric surgery. We can see if you want to ask questions, and I'll try to answer those as we go. Very informal. And I know some of y'all have probably seen me already. Some of you may not have. So I don't want anybody coming in and thinking that you're going to be on a diet for the rest of your life, that you're going to have to count calories, measure everything that you eat, never be able to go out to a restaurant and eat again. That is not what this surgery or our program is about. Really what we're in this for is to make you healthier, make your lifestyle healthier. This is not just a lifestyle that you should lead, but it's for the whole family. It's really getting back to basics. So what are those basics? We need to eat good, nutritious foods, and we need to move our bodies. I always kind of go back to my ancestors and how they lived. And we have to kind of take those concepts, those nutrition concepts, and the exercise concept to our everyday life. So I don't ever put you on diet food. It's not something special that you're going to just cook for yourself and then have to cook for the rest of the family. It is good, lean, quality proteins. So if the protein is a meat, so if it walks, if it runs, if it flies, if it swims, it's a protein. And when I say good, lean qualities, I mean chicken and turkey. I mean beef, pork, fish. None of it is breaded, but you can also use all the seasonings that you want, so you still enjoy your food. I want you to eat non-starchy vegetables like green beans or broccoli, cauliflower, carrots, spinach, turnip greens. The darker the color, the better. How do you turn? I just saw a question come up about how to turn on the video. Can you not see me anymore? Somebody asked a question, how do I turn my video on?
Go to the settings and hit allow camera.
Okay, go to your settings and hit allow camera. Okay, sorry. That just kind of... Oh, no, you can't turn your camera on for us to see you. I don't think that's how this works. No, nobody needs to be seen. Just me. It's not like a Zoom. So, okay. Sorry. Okay. As long as you can see me and hear me, you're good. So the lean proteins, and I want you to eat good, nutritious, non-starchy vegetables. And that's how we all should eat. We need to fill our plates up with lean proteins and non-starchy vegetables. And then I want you to choose good carbs when you are able to. I don't think we ever should limit, or I shouldn't say limit, I don't think we ever should avoid a food group. However, I do believe that we need to limit the amount of carbs that we take in. When you do choose a carb, it should be a good carb, and that would be a real piece of fruit or a starchy vegetable like potatoes, um, corn, or it could be any type of starchy bean or pea. And the reason those are good is because they provide you vitamins, they provide you minerals, and they also provide you fiber. And there is nothing added to it. There is no added sugar to that. It's real sugar. Um, Actually, God put that in there, and it's a good sugar. Now, that doesn't mean that we can have unlimited amounts. Um, we Americans eat an enormous amount of sugar in our diet. What is recommended is that the average male should get about 9 teaspoons of added sugar in their diet in a day. The average male gets about 24 to probably 30 teaspoons. We put sugar in everything. And now it's not just in cakes, cookies, pies, pastries, baked goods. It's also in soups, it's in salad dressings, it's in condiments. You name it, we have put sugar in it. What does sugar do? Well, it doesn't do anything really, or those added sugars don't do really anything good for our body. It's empty calories, does not give us any nutrition whatsoever. It actually can inflame our body, and it can lead to heart disease, it can lead to diabetes, it can lead to strokes, it can lead to high blood pressure, it can lead to cancer, amongst other things. So the added sugars, I couldn't even name you all the added sugars that we put in our foods. But if you want to check it out, go to Google, type in all the names for sugar, and over 60 names come up. And what's happening is we're putting all these added sugars to help give more flavor to our foods. I think we're doing it a little bit to make it more addictive because sugar is addictive. Um, it's a longer shelf life. It keeps the foods fresher. So we're adding all these additives, and our bodies aren't supposed to be able to use that. It's too much. And that's why we see that our society is more overweight than it's ever been. An example that I give a lot of times is if you want to know how much added sugars in our food or carbs, how carb rich we are when we eat, go into one of the biggest convenience stores that you can think of. Probably one here in Tupelo would be Love's. Okay. Go and find something to eat that does not have carbs in it. In that whole entire store, you've got about 3 choices. You've got your regular nuts. Almonds, pecans, walnuts are normally the best. They have good carb in them, just a little bit. They have protein in them. You've got your choice of beef jerky, which some of it's decent, some of it's the oily fake stuff, but that doesn't have any carbs in it unless you get one that's sweetened, which you shouldn't do. And pork rinds, which we don't need to eat pork rinds every day. Okay. It's a lot of saturated fat, but that's it. Everything else in a convenience store is full of carbs. Even if you go into one where they cook the food too, it's all breaded, it's all fried. So that's what we're up against. But we put sugar in everything, especially when we pull fat out. That's what the low fat and the fat-free versions, the majority of the foods are. When we pull fat out, we have to replace that taste with something to make it edible. And 9 times out of 10, we put sugar in it. So you need to eat real food. It's real simple. Ask yourself 2 questions when you're going to eat something. Is this going to nourish my body? Because that's truly what food is for. And did God put it on earth just like that? Is it real? The majority of the time, you want to stay away from all the processed foods that we eat. Not only do they have a lot of added sugar to them, they also have a lot of added chemicals. And our bodies aren't equipped to digest those things. So I tell a lot of people, read your food labels. If your food has a label on it, read it. Look at the ingredients. Number 1, try not to buy anything that's got more than 3 ingredients in it. If it does have more than 3 ingredients in it, you need to be able to pronounce all the ingredients, and you need to know what that ingredient is. So if you cannot pronounce a word on the ingredient list and you cannot tell me what it is, your body more than likely cannot digest that, and you shouldn't eat it. So it's the way you eat after bariatric surgery is no different than the way the average American should eat the majority of the time. I'm never going to tell you to never have another piece of birthday cake ever again. You can. However, you're not going to eat the whole piece. You're going to eat maybe 1 bite, and you're going to be like, oh, that's enough. And let's not do it on everybody else's birthday. Let's just do it on yours. It's moderation, but the majority of the time you want to eat your protein, non-starchy vegetables with a little bit of good fat, because your body still needs a fat intake. It just needs to be good fats like real olive oil, avocados, olives. Those are natural fats. Real butter, not margarine. That's about 1 ingredient away from plastic. So is it kind of like, I'm going to ask questions as they come up. Is it kind of like a keto diet? Not really. A true keto diet is you know exactly how many calories that you need in a day, and 70% of those calories come from fat. I love some butter, but I don't know how I'm going to eat that much fat in a day's time. That's a true keto diet. What a lot of people do on keto is high protein, low carb. So yes, it is like that. But once you have surgery, you have to get in your protein no matter what. And the only way to do that is to eat food. Eat your protein. Eat your meat products. Lean, of course. I'm not telling you to go out and buy bologna and eat that, or Spam, or buy any sausages. We need to have the white meat of the chicken and turkey. We need to have eggs. We need to have fish. Lean beef, pork, deer meat, all that kind of stuff. And then you're going to choose your non-starchy vegetables. And then you choose 1 good carb. That's how we all should eat breakfast, lunch, and supper. Now, with y'all, after surgery, you will always eat your protein first. Once you can get in 60 to 70 grams, and you still have room, or you're still hungry, you will choose bites, and it will only be bites, of a non-starchy vegetable. And then when you're ready to maintain your weight loss, that's when you'll probably be able to have your protein, bites of a non-starchy vegetable, and then maybe a bite or two of a good carb. And you can take that concept anywhere, whether you're at home, whether you're out to eat, whether it's fast food or sit down. You order your protein first, you order a non-starchy vegetable, and then you order a good carb. Somebody asked about protein shakes. Yes, there are certain ones that fall into our guidelines. We go over those. I have a whole list for you of the ones that you can choose once you have surgery. Do not, let me just go ahead and tell anybody that's getting ready for surgery, do not go out and stockpile a bunch of protein supplements. When you come into your virtual education class the Wednesday before your surgery, I tell you exactly how many to go buy at that point to get you through the pre-surgery plan, diet, and right after surgery. A lot of times your taste buds change right after surgery, so the way people kind of describe it is everything's kind of enhanced. Everything's really, really sweet. And you might not like certain protein shakes after surgery. So I don't want you buying a lot because 60 to 70 grams of protein is not an option after surgery. So you don't want to stockpile and then not want to go buy a protein supplement that we recommend that might not be as sweet or something that we have to change and then be like, well, my whole garage is filled with Premier Protein and I can't go buy that. I'm not going to go buy that. 60 to 70 grams of protein is not an option. So we have to get it in, and we have other ways. If you don't really like the protein supplements, the ready-mades after surgery, you can get other things. So we will figure out a way. So that's my kind of take on protein shakes. Now, long term, you will never be dependent on protein shakes the rest of your life. Honestly, by about 9 to 10 weeks out from surgery, I have you weaned off all the protein supplements. That is not a lifestyle change. That's a crutch. And what people tend to do is, well, I'm getting my protein in, I'm getting 60 grams of protein in, so now I can just choose whatever food I want. And they tend to choose poor quality foods. And if you put poor quality foods in after surgery on a regular basis, you will stop losing the weight and you will gain it back. That's why we don't do calories. That's why I don't make you count calories. It doesn't work. You have to put food in that is good quality food. So I have a question that somebody heard that bariatric fusions are good vitamins. Yes and no. I'm sure they are. I'm sure they give you everything that you need from a bariatric standpoint. However, you have to order them online. They don't usually put all the vitamins that you need and minerals that you need in one vitamin. So you have to buy multiple ones and it can get very expensive. The only one that we require is a multivitamin with iron. Right after surgery for the first 3 months, you cannot swallow a pill. You cannot do any type of gummies. So everything has to be crushable, chewable, liquid. And the easiest one that we have found, the least expensive and the readily available, is what we recommend you get is a Flintstone Complete Chewable. Like I said, it's cheap. You can go to Walmart, but we have options, and we have those listed. So we don't start any vitamins until after you go home from the hospital anyway. And so on your education day, I go over that too. But it's just easy. And I'm not trying to, I don't want to break the bank for y'all. I mean, you can go to all those Bariatric Advantage and Bariatric Fusions, and I'm sure they have some good products. We sometimes get vitamin samples. And so I figure if I'm going to give them to y'all, I should at least try them. And so one day, Vivian and I were going through multiple kinds, and she wouldn't even try them because she saw my face once I tried them. They weren't real tasty. And honestly, I threw them all away because I wouldn't even give them to y'all as samples. So, any other questions? So basically what I want you to take home from this is not a strict diet, okay? This is not something that you need to stockpile protein supplements for the rest of your life. This is not something that should prevent you from going out and having a good time at a restaurant. This is a lifestyle change. And so the majority of the time, you need to choose good, nutritious foods. But after surgery, you always have to get your 60 to 70 grams of protein first. And you need to move. Okay, so are cottage cheese and Greek yogurt good protein snacks options? Yes, very good. They are very good options. So the Greek yogurt, the one I tend to recommend is the Oikos 000 in the black container. It's got protein in it, about 15 grams for one container. It does have carbs in it, but it's got a lot of fiber. So that's good for you. The cottage cheese, a really good protein source as long as you don't put a ton of fruit in it. I mean, eventually down the road after surgery, you will be able to put a few little blueberries or something in there. But like a fourth of a cup of cottage cheese is one serving of protein, 7 grams. So it's an excellent source. How long does stage 1 typically last? Stage 1, when you get home from the hospital on Thursday afternoon, night, and it lasts until you come and see us at your 2-week post-op. You don't know that you're ready for stage 2 until you see me. So what will happen is you have surgery on Tuesday, you're discharged on Thursday nights, not that Monday, but the next Monday, you will come in and see your surgeon, either Dr. Coulson or Dr. Pinson, and you will see me. Okay. At that point, I will advance you to stage 2 if you can. Meaning, if you're not getting your fluid in, 64 ounces of non-carbonated sugar-free fluids, and you are not getting your protein in, 60 grams of protein, then you don't have room for anything on stage 2. So 5 weeks after surgery, that's when you will start eating real food again. And it will be bites. So, I mean, like 2 bites at a time. But I'll walk you through all that. Y'all know I've got handouts and we go over those. What about before surgery? What does the diet look like then? Okay, so before surgery, 10 days prior to surgery, you will go on a low carb diet. That's where you get 2 carb choices a day. You can have all the protein, all the non-starchy vegetables, and all the good fats that you want. You just limit to 2 carb choices a day, which you have to measure. And then 4 days prior to surgery. So it will be the Friday, Saturday, Sunday, Monday before your surgery. It is just the clear liquids. that are non-carbonated and sugar-free. And you will get a protein supplement 3 times a day. So you will do like a premier protein at breakfast, one at lunch, and one at supper. The reason why we do that, we are shrinking the liver, okay? The liver is right there by the stomach where the surgeons have to go in laparoscopically. And your liver really does produce glucose on its own, and it kind of hoards glucose too. It stores it. And so the more sugar, the more carbs that you eat, the bigger the liver can be. And so we really want to shrink that liver so that the surgeons have a good view of the stomach. So it's all about safety. Okay, this is not just for us to see how much weight you can lose and be awful, hateful people. It's truly about having the safest surgery. You don't want the surgeon to go in there and have to abort the surgery because they can't see the stomach. And so that's why we do that. Any other questions? Vivian, if you're seeing any more, you can come in and tell me. Vivian's in her office and I'm in mine, so that's why sometimes I don't see all the questions. Yes, please do use the chat box. That's the ones I can see. I can't see the Q&A. So if you see the chat down there at the bottom, that's where you want to ask questions.
Can you see the one, Ginger, that says a liquid diet required before surgery?
I see one that says, what about before surgery? What does the diet look like then?
No, okay, so this is in the Q&A box. They want to know, do they have to go on a liquid diet before surgery? And the next one is, how often should we eat in a day one? In a day.
How often should they eat in stage 1?
I'm thinking they want to know, when do they start
Okay.
getting liquids after the surgery?
Okay. So the first one is, how long before surgery are you on a liquid diet? Again, 4 days. That's it. 10 days prior, it will be a low carb for a week. And then the Friday, Saturday, Sunday, Monday before surgery, it is just all your non-carbonated sugar-free fluids and 3 protein supplements a day. Okay. And when do you start eating again? After surgery, you are on liquids only for 5 weeks. So it's just like that Friday, Saturday, Sunday, Monday before surgery. You are unlimited on any of the non-carbonated sugar-free fluids. You have to get in at least 64 ounces of that. And you only have to do 2 protein supplements a day for 60 grams, not 3. Stage 2 is about, like I said, 2 weeks after, but it is still fall through the fork thin liquids. We do not puree anything. I have certain things that you can choose. You don't want to fill up on a lot of sugar and carbs. For example, I'd rather you eat a Greek yogurt that you've thinned out with Fairlife milk than a whole container of applesauce. Applesauce is pure sugar. And then I give you a date where you do start food. And it is soft textured food. You start with like scrambled eggs, fish. We go over all this. It's all on my handouts when we get there. But it's to heal. You're going to have up to a foot-long incision inside that we have to heal. And so you don't want to put anything in there that is solid or that could get stuck in that suture line or push it out and open it. So that's why it's just liquids for so long. You don't even want, the reason that I don't personally like pureed foods, number one, I think that's gross. Who wants to eat that? But number two, even if you like pureed some mashed potatoes and made them really thin, when you swallow solid food like that, even though it's thinned out, it turns rock solid in your stomach. And it can push out that suture line. So we're doing all of this for safety reasons, to heal. Let me go ahead. Yes, broth. Okay, broth is, it just says, what about broth? Broth, if you can see through it and you've strained it, like chicken broth, vegetable broth, beef broth, bone broth, that will always count towards your clear liquids. So that's part of your clear liquids if you want that. Will you be on bed rest? Absolutely not. So the question is, will we be on bed rest after discharge? No, ma'am. Within an hour of getting to the floor after surgery, we have you up walking. There is no bed rest, so everybody bring your tennis shoes. And it's at least a mile a day. So we have our own floor at the hospital. It is closed off to the rest of the hospital. It is just our patients and our nurses. And so we've mapped out our little hallways, and it's 11 laps for a mile. You do not do it all at one time, but you're going to want to be up. That helps all the gas release the best way. It also helps the fluid go down a little bit better. When you're sitting straight up in the bed or you're walking, gravity helps pull that fluid through, and that makes you feel better. But the more you walk, the better you're going to feel. And then when you go home, you have to be up walking at least once an hour. You can't pick up anything over 10 pounds for the first 6 weeks, so it's basically walking. But we need you up walking to help prevent surgery-induced blood clots. So no bed rest at all. But believe me, you're going to want to be up walking because it makes you feel better. I saw someone on a group drinking Gatorade with protein from Amazon. What are your thoughts on that? I actually saw the Gatorade protein supplement in Walmart about a month or two ago. And I just barely glanced at it. I didn't even see what flavors there were or anything. But what I did see was it was 30 grams of protein. So it's low in carb and it's high in protein. So I think it's fine. I've been telling people that they can look for it. I should have bought some to try it, but I just didn't. But I did see those at Walmart recently. How long will you be sore? That's kind of individualized. We don't really hear anything about being sore like from the actual surgery from removing your stomach. Some people that have to have that hernia repairs are a little more sore than those that don't. And Vivian, you can chime in anytime you want to. It's more of somewhat of a pain from the gas being released. And it could be a pain in the back, lower back, it could be pain in the shoulders. But I'm telling you, the more you walk, the more that gas is released. And within a few days, it should be all gone. But like soreness, like, it hurts to get out of bed or anything, no, we don't really hear that much about it. Is that your take, Vivian?
It is. It's normal, just like any other surgery that you have. You're going to be sore for a few days. It's going to be times certain spots as far as the largest incision that will be sore the longest. But other than Excruciating pain? No. More so, like Ginger said, the trapped gas, the CO2 that they use to insulate your stomach. That is the worst part of it. And if anyone has ever had laparoscopic surgery, then you know what I'm talking about. But I'm just speaking for myself. I really didn't have a lot of pain at all. Incisions, they would sting, and that's understandable because just had an operation. I was sore. I felt kind of bloated because of the CO2. Walking helped a lot. I had surgery on a Tuesday, discharged on a Thursday. By that Saturday, all the gas was gone, and I felt fine. I didn't have to have anyone to stay at home with me that week. On that Monday, my husband went to work.
Yes. So, next question I see. So, unsweetened tea is a no, absolutely not. Unsweetened tea, and you can sweeten it with any type of artificial sweetener. Will count towards your 64 ounces of fluid after surgery. You can do Milo Splendid tea that's already in the gallons made up at Walmart. You can do the diet green teas that are in the bottles. There is a Lipton's Southern Sweet tea bag that's already sweetened with the Splenda, I believe. If it's not Splenda, it's stevia. So you don't have to add anything, and you brew it just like you would normal tea. So no, unsweetened tea or any of those that I just listed count towards your 64 ounces too. How long are you in the hospital? You have surgery on Tuesday, depending on what time or what case you are when you go in. And then you are discharged Thursday afternoon. So you stay 2 nights. How long should we be off work as an office job? At least 2 weeks. So again, you have surgery on Tuesday, not that Monday, but the next Monday you will come in and see your surgeon and me. As long as you don't do anything strenuous and you do not pick up more than 10 pounds on a daily basis, normally he lets you go back the next day. But you need to take off the first 2 weeks because it's very hard. Your stomach is really, really small, and it's really hard to get the fluid and the protein in. And it takes several days to kind of get that down. And what happens when we go back to work too early is we get busy and we forget to drink. We don't get our protein in, we don't get our fluid in, we get dehydrated very quickly. You can't make up for it because you can't gulp or guzzle water or any fluid for that matter. It's sipping throughout the day. And you end up dehydrating. You have to come back in, take off work, and see us for IV fluids. So just take that 2 weeks off, and then by then you pretty much have it all down. So if you don't do anything strenuous, he normally lets you go back to work 2 weeks from the surgery day. But ultimately, that's up to you and the surgeon. When can you begin exercising without restrictions? We'll release you at 6-week visit, your 6-week post-op visit. That's when we'll release you, and that's when you will want to start some strength training. We have an exercise physiologist on staff, and when you come into your pre-surgery education class, she'll go over the exercising and all that stuff with you. How often should you eat meals and snacks? So at first, when you do start first eating again, and I weaned you off your protein supplements, it could look like 5 to 6 small protein meals a day. You're not grazing all day long because you can't drink when you eat. So you have to stop and start that eating so that you can get your fluid in. But I tell you exactly how to do that. So it could for a little while look like 5 to 6 small protein meals. And when I say that, one meal or one snack might be a string cheese, and that's all you have. But eventually it will hold up to about a cup. And you can get your protein in 3 meals and maybe one snack. It's really up to you. What about plant-based proteins if you don't eat a lot of meat? Okay, so you can do edamame, like the frozen kind of edamame. It's got a lot of protein and very low carb, a lot of fiber. You can do tofu. You can do fish, um, any type of seafood, as long as it's cooked. Yeah. Oh, look, this edamame. It has, for a third of a cup, 14 grams of protein and 9 grams of carb, but it's got 6 grams of fiber. So that's a really good source. Unfortunately, beans aren't a real good source of protein for you after surgery because you're not, volume wise, you're not going to be able to hold enough beans to get your protein in. But eggs, cheese, you can do Fairlife milk. So if you don't like chicken and turkey and beef and pork, there's ways around it. You can do Greek yogurts, cottage cheese. So we've got lots of options. So, oh, I have a wedding that I'm in the beginning of the summer. How soon after surgery would I be able to walk down the aisle as a bridesmaid and go home right after? Look, you can drive yourself as long as you haven't had any pain medication in the past 24 hours. I mean, 2 weeks out, when y'all come to your 2-week post-op visit, the majority of you drive yourself here. I mean, we want somebody to drive you home from the hospital, of course. But as long as it's not far away, you don't need to travel for 6 weeks, like fly anywhere or sit in a car for a long period of time. That would be at least 6 weeks. But just to walk down the aisle, down the street at the church, the next week, I would think. I mean, you're not on any type of restriction like that. I hope that answered the question. I think I answered that one. How long post-op can we do full gym workouts? That will be 6 weeks. Oh, good. It's 5 minutes from your house. I think you'll be fine. I hope it's not going to be a long ceremony because you don't need to go more than about 10 minutes at the most without sipping something. So maybe they'll just let you have some water up there at the front. So you can just kind of sip on your water. So, anything else? Any other questions that I could answer or we haven't discussed that you had questions? I think I saw all the questions. I'm just going through them again to make sure. Yes, I did. So if y'all don't have any more questions, I'm gonna give you one last chance.
Did you answer the one about plant-based protein?
I did.
Okay.
That was the edamame question.
Okay. And what about the dairy
No,
products?
I didn't see the dairy.
How would that affect the patients after surgery?
How would dairy products affect the patient after surgery?
Mm-hmm.
It really depends. We don't really have a lot of problems just initially after surgery, or if you didn't already have a lactose problem before, we don't really see that much difference. But like the Fairlife milk, which I'd rather you choose because it's got more protein and less carbs in it, is lactose free. So shouldn't be a problem. How long should we walk each hour once we are home? I have it mapped out hour by hour for you on your daily to-do list. And what I say is 5 to 10 minutes at the top of each hour. You walk. You can walk around your house. You can walk outside. You can walk on a treadmill as long as it's not on an incline. So 5 or 10 minutes. It's at your pace. This is not by any means a race or sprint.
All right, and the next question, someone asked about if someone is staying with you, when can you swap out? And I'll answer that one.
Okay.
So because of COVID, and I know that the numbers have started to dwindle down, but you also have to remember that every time you swap out a visitor, you're re-exposing someone possibility of getting COVID. So when the numbers were really high, we were allowing, of course, one visitor need to have a mask. If you're walking in the hallway, even for the patient, you need to have your mask on unless you're in your room. And it needs to be that same visitor and not swapping out visitors, because every time you swap out, you're putting yourself and someone else at risk. So I'm really not sure what the hospital rules are since the numbers have started to come down a lot, but in the past, it was just one visitor and it needs to be that same visitor. They can leave, go get something to eat or something like that and come back, but changing to if your husband's there, then the next it'll be your daughter, and then the other half of the day it may be you're just re-exposing and taking a risk of exposing someone.
Any other questions? Okay. Well, thank y'all for joining us. Does someone need to be there with you? Not necessarily. Nobody has to stay with you at night, and Vivian will tell you from experience, those couches aren't real comfortable. But
Nope, they're not. Also,
you just have to have somebody to bring you, and you have to have somebody to pick you up and take you home. You don't necessarily have to have anybody stay with you. So.
and it was another question about acid reflux. Is that a problem after surgery? If you have acid reflux before you have surgery, then it's potentially that you won't have it after surgery. If you've never had acid reflux and then you have it after surgery, most of the time, over a course of about 6 months to a year, it goes away. Now, it's individualized, so it's different for every patient. But I can say just from the patients that I see on a regular basis, we do not have a large number who have severe reflux after the surgery.
We have one. Is there anything we need to have prepared to take to the hospital? We kind of tell you everything that you need. And it's in the book too that you will receive once you get your surgery date. In your education class that we do the week before your surgery. So we'll let you know. There's nothing from a nutrition standpoint that you have to take. So you're not going to be taking your vitamins there. You're not going to be doing any protein in the hospital. So from my standpoint, no. Is the weight loss fast or slow? You see a bigger weight loss at the very beginning, of course, but a lot of that is a water weight right at first. And it does slow down, which you want it to. You don't want to lose all of it right at the very beginning or really fast, because you're not really improving your health. You've just lost weight. We want to look at the whole picture, the inches that you're losing, the medications you're coming off of, the stamina that you have. Maybe you're not short of breath. Maybe you come off the Cpap machine. So after surgery, it's not really strictly about that number. But yes, at first you will see a bigger number. Everybody's different, so don't ask me. I can't tell you an average. Um, and then you'll see it kind of trickle down. Sometimes you go through stalls. Um, as long as you keep on that daily Milo, the protein, the fluid, the vitamin, and the exercise, your body is going to lose that weight as it should. Are you given anything for nausea to take home? Yes, you get Zofran.
And did you go over the question about, is there an artificial sweetener that you recommend more than another?
Nope, didn't see that one. So here's my take on artificial sweeteners. You know, when they started making the pink packet, Sweet and Low, saccharin, we thought that that was good. Years on the market, they did studies, probably not so good for us. Then they came out with the Equal. Thought that was better for us. That's the aspartame. And it's been on the market long enough that they've done research and it probably not so good for us either. In large amounts. Now, if you put one Equal in like an unsweet tea, I think you're fine. But if you drink it all day long and in large amounts, I don't think anything's good for you that way. The Splenda, I think some research is coming out now. Haven't really seen any that says it's awful, but it's chemicals. So again, I don't think you need to do it in large amounts. And then the stevia and the truvia that are supposed to be more natural, they haven't been on the market long enough for us to do studies, long-term studies, so we really don't know yet. I know that probably didn't really answer that question. Do I drink artificial sweeteners? Yes. Do I drink as much as I used to? No. I try to get in more water. I stopped putting artificial sweeteners in my coffee. All I do is cream in the coffee. But I have a little bit of an addiction to Diet Coke, but not like I used to. I don't put anything in my unsweet tea either. So if I get it, it's in like one Diet Coke a day. Do you want to answer the question about the Cpap machine, Vivian?
About, are you likely to come off the Cpap machine?
Yeah.
It's very individualized. So it really, sometimes after 25, 50 pounds, some people are able to come off of their Cpap machine, and some people are at goal BMI and still using their Cpap machine. So it's not necessarily just because you're overweight that you automatically just come off of the Cpap machine. That's the reason why we tell you to follow up with pulmonary when they give you an appointment after you've out of surgery for a while. That way you can actually follow up with them. They can assess you and determine whether it needs to be turned down or whether you just need to get rid of it completely. So it's individualized per patient, but it's a good chance that you will be able to come off of the Cpap machine.
Okay, yes, I mentioned Milo's. What about Milo's 0-calorie tea? Is that just the unsweetened? So in the Milo's, you can have the Milo's unsweetened tea in the gallons, and you can also do the Milo's Splenda tea. I think it's in the yellow top. But yeah, my kind of rule of thumb, if you want to know if you can drink it for a clear liquid, number one, it's got to be clear. Number two, no carbonation. And number three, if it has more than 10 calories per serving, you don't drink it. So anything between 0 and 10 calories, clear liquid you can have. But all I've seen in Milos is Splenda Milos, sweetened and unsweetened. I've not seen a Milo's 0. Any other questions that we could answer for you? Okay, well, thank y'all so much for joining us. We really appreciate it. And we will see y'all soon. Thank y'all.